What we're doing is we're collecting antibodies from plasma. When someone's ill with a viral infection, after a period of days or weeks, they begin to make neutralizing antibodies, small protein molecules which help to destroy the virus. And the basis of this is to collect from the blood these antibodies and then give them to another individual to help treat the infection. It's a technique which is decades old. It's been used to treat other viral infections such as polio, measles, mumps, etc., Ebola, and SARS not too long ago. So we're able to offer this therapy because we have the technology and the trained staff to do so. We're one of the largest stem cell collection programs for the National Marrow Donor Program in the world. In fact, we are their largest program. That program right now is severely impacted by COVID-19, and we're not able to do those transplants. We have the staff, we have the machines, we've retooled ourselves to be able to provide this service to San Diego. Patients right now are those patients who are the sickest, who are not doing well, and who may need to go to an ICU and be on a ventilator in the very near future. Those are the patients we're targeting first. The reason we're targeting this patient population is we're trying to keep them off of ventilators. That's a very critical and sometimes life-saving step, but it's also a very serious step. If we can keep them from becoming that sick, we can get far more patients better and far more patients out of a hospital. The data so far indicates that it's probably an effective therapy when used early enough. We think in the first 2 weeks of illness is the optimal time to give this type of treatment. The process works by first identifying someone who already has antibodies. When someone's been sick with the COVID-19 virus, they'll begin to fight off the infection within the first week to week and a half, normally. Within a few weeks of that, they're making sufficient antibodies that they could donate for another person. So first we identify someone who's willing to donate and who's over the infection. They need to be about 2 weeks after their positive test for COVID and about 3 to 4 days after their last symptom. That's where the window period begins. We collect their antibodies, particularly the IgG, so-called neutralizing antibodies, and give that to the person who's infected now. They can't make their own yet, at least not enough to get them over the infection. So by giving this booster of antibody, hopefully enough of the virus will be destroyed that their own body can then begin to make the antibodies and fight it off on their own. It'll take probably many months or even longer to develop an effective vaccine, and so far the antiviral medications have been only partially effective. So plasma treatments with neutralizing antibodies will be needed everywhere, and if it works well, the concept would be that blood centers like ourselves at Scripps and others would gear up to be able to produce plasma for patients in need.
So the first time I started feeling sick, it was just kind of a sore throat. It seemed like a normal cough cold. My wife was sick about a day before, so maybe it was just whatever she had. But it also coincided with some fatigue and body aches and just not feeling generally myself. After that, it turned into more of a headache, kind of this debilitating kind of sinus headache in the afternoon specifically, where I would just have to go kind of lay down and relax. And then the weird one was I couldn't smell or taste anything for about a week after that. Overall, it was about 2 weeks total, and then I felt fine. So I actually contracted this likely on a ski trip out in Utah. A good friend of mine who was part of that trip was feeling really bad, had 103-degree fever and feeling rough. So he went into urgent care, ended up finally getting tested. Once he came back positive, I figured, okay, maybe I should go get tested as well. So I did a video call with the Scripps nurse, and the next day I came in for a test, nasal swab, and a few days later I found out that I was actually positive. My wife got tested the very next day. She was kind of past her symptoms already, so she came back negative, in fact. So after we recovered, essentially we were sick, but we were not that sick, right? Nobody was hospitalized. We were feeling good, luckily. But essentially we kind of walked around with this feeling of immunity, right? This feeling that you have tiger's blood. And we were trying to figure out how can we go help people, right? We heard at that time, Bill de Blasio was asking for nurses and people with medical experience to go to New York. It was like, well, I can't help with that, but this is something I can do, right? We're regular blood donors, and it was how can we help this situation? So when I got the call from Scripps, it was a no-brainer, right? It was like, okay, hey, you might be able to save someone's life if you go sit in this chair for 45 minutes and you get a Gatorade, right? It's like, yeah, of course I'm gonna go do that. Yeah, so the experience of the actual procedure itself was pretty straightforward, right? You go and you sit down in the bed, and we're regular blood donors, so I've had that experience before where you're just tapped in on one arm, basically the only difference. It takes about 30 minutes where they take your blood and they run it through the centrifuge to split out the red blood cells. You get your cells back. So basically I had another IV in the other arm, and just they cycle your blood through.
Hold your breath for a second. Oh, good. Okay, stand my back to say so through that. Okay. Do you have any questions at all?
No, I think I've asked them.
Okay.
10 days
Okay.
is usually when you start to see respiratory
Yeah.
get better.
Okay.
So this is not going to be
Yeah.
immediate. 7 to 10 days is the
Give me
window.
like a sliding scale of what the impact may
Yeah.
be. Just share that program, but
Yeah, the guy kind of said something like that he should have had the data out sooner, but he did get data from the company in
I
order to
see.
make them spreadsheet to give it out. So yeah, it's interesting.
weeks ago, which is
Oh.
like obviously a bummer, but it also kind of coincided with our 3 kids needing to be homeschooled. So
Part of their discharge process is just to have a discussion about whether they would be willing to provide antibodies.
It would be a great discussion to
And I
have.
think that everyone would be happy to do it.
Absolutely.
And I think you could increase your volume
I only have 15 people.
just by that.
Mhm.
So I had 3 patients.